And look who's with us, Dr. Mallika Marshall. It is so good to have you back in studio with us.
So happy to be back.
Great to be
able to. It feels so weird,
It does.
it?
It does.
But good. A good weird.
Readjusting, but so good to see you in person again. Our first question is from Sally. She says she received the Pfizer vaccine in March, but before the vaccine, she had a complete physical, and she says her blood sugar was normal before the vaccine, but then elevated after the vaccine, and she wants to know if it was, in fact, a bad reaction to the vaccine.
Not necessarily a bad reaction, but there have been some reports of people with diabetes having an elevation, a temporary elevation in their blood sugar after getting vaccinated. So I suggest that people with diabetes, once they get vaccinated, monitor their blood sugars for the next several days and call their doctors if there are any significant changes.
Makes a lot of sense. All right, Guy asks, if I had COVID-19 in March 2020 and my quantitative antibodies are currently greater than 250, why do I need to be vaccinated?
Well, you know, the FDA just recently said that we should not be relying on antibody tests to determine whether we are immune to the coronavirus, because it's still not clear exactly what that level needs to be or how long your antibodies actually last to provide protection. So even if you have had COVID, you still need to get vaccinated, not only to optimize your protection of the coronavirus, but also for those emerging variants that we're worried about.
And that's very, very important.
Exactly.
John says, I had the virus and then had the antibody infusion. How does the infusion affect my own produced antibodies?
You know, it's actually not clear, which is why if you have had monoclonal antibody infusions because you were infected with the coronavirus, you really should wait 90 days before getting vaccinated because we're not sure how it might interfere with the effect of the vaccine.
Interesting. So some things you really do need to talk through with your doctor.
Exactly.
Before you get it. Sarah asks, my concern is if I do get the vaccine, will it cause bad effects to the heart? I was recently diagnosed with a PFO. You'll have to explain what that is. I did ask the cardiologist, and he said I should. I also have high blood pressure and diabetes.
So a PFO is a patent foramen ovale, and that really just means a certain type of hole in the heart. But there really is no reason to suspect that getting vaccinated is going to have any adverse effect on your heart, especially if your cardiologist is still recommending that you get vaccinated. So I would follow his or her advice, and just keep in mind the fact that you have diabetes and some underlying medical problems means you're at high risk of complications from COVID-19. So don't worry so much about the vaccine. You really need to worry about getting infected.
And at this point, those are the people that we're really worried about.
Exactly.
Right? All right, Dr. Mallika Marshall, thanks so much.
You're welcome.
Great to see you. And Dr. Mallika offers her best advice, but as always, consult your personal doctor before making any decisions about your health. If you have a question for Dr. Mallika, here are the 3 ways to reach her. Her email, drmallika@cbs.com, on Twitter @Mallika Marshall, or Facebook message her, Dr. Mallika Marshall.